Well, good afternoon or good morning, everyone. Um, we'll begin the webinar here shortly. Please stand by. Good afternoon, everyone. We'll give it another minute and then we'll get started with our webinar this afternoon. Thanks for joining us today. Well, good afternoon, everyone. My name is Bill Cole. Welcome today to today's Physical Activity Alliance webinar entitled All Health is Local, Lessons from the Kansas City Physical Activity Plan. My name is Bill Cole. I'm the chair of the U.S. National Physical Activity Plan. And it's my pleasure to welcome Dr. Robin Shook from Kansas City, which is a complicated place because there's Kansas City, Kansas, and Kansas City, Missouri. But Dr. Shook is the director of Weighing In, who's at the center of Center for Children's Healthy Lifestyle Nutrition at Children's Mercy Hospital in Kansas City. He's in the Department of Pediatrics there, where he's an assistant professor of pediatrics. And he's also an assistant professor of pediatrics at the University of Missouri, Kansas City, in the Department of Pediatrics. Today's webinar is brought to you by the U.S. Physical Activity Alliance. The Physical Activity Alliance is an organization of interested parties seeking to advance physical activity throughout people who live around the world, but certainly in the United States first and foremost, focused on advocacy, focused on professional development and planning, physical activity planning, which is what we're here to talk about today. They say that all health is local. That's what the title of our seminar is. And while there is a U.S. National Physical Activity Plan, there's really that focuses on strategies and tactics for advancing physical activity in societal sectors. There's only a few places that actually bring this to the ground, and Kansas City is one of them. And I wanted to highlight the good work that they're doing in Kansas City. So, Dr. Shook, I'll turn it over to you and let you let us know where you are with things in Kansas City. Welcome.
Great. Well, thanks for that introduction, and thanks for the opportunity to share the things that we're doing in Kansas City. And like I said, when we were chatting before we started, I really appreciate this opportunity, not only so we can share what's happening in the Midwest, in our little part of the country, but I think it's also an opportunity to learn from others and take all the good things and lessons learned from other places that are doing this type of work, both in the United States and across the world. So my name is Dr. Shook from Kansas City. I'm at Children's Mercy Hospital at a place called the Center for Children's Healthy Lifestyles and Nutrition. It's a very unique place because it is actually a joint venture between the University of Kansas Medical Center and Children's Mercy. So we have 2 affiliations there. And then Children's Mercy in turn is affiliated with the University of Missouri, Kansas City. And so we have other affiliations there. So the result is a very busy slide that you can see here with all of the different affiliations. We're going to be talking about our work with the Kansas City Physical Activity Plan today. I'm going to mention on just about every slide some piece of information that you can probably find on our website. And so our website is right there in white, kcphysicalactivityplan.org. So, feel free to go to it now, go to it after the talk, and try to find some of the things that we mentioned. Hopefully it is helpful for you as you do similar work wherever you live. So here's what we're going to do today. And this is kind of cutting right to the chase. I'll give you an overview of the program that I run, which is the Kansas City Healthy Lifestyles Collaborative. I'll give you an overview of the initiative that we run out of the collaborative, which is the Kansas City Physical Activity Plan. And I'm going to talk about 5 general lessons that we've learned doing this work. And those lessons are right there if you want to tune out for the rest of the presentation. So I'm the director of a program at Children's Mercy that is called the Kansas City Healthy Lifestyles Collaborative. We seek to align programs that prevent and reduce childhood obesity in Kansas City. So Dr. Cole mentioned in my introduction the name Weighing In. Our group was actually called, or our program was actually called Weighing In up until about 6 months ago because we were heavily focused on childhood obesity. And so, when it formed several years ago, there was the somewhat clever name of Weighing In. We've now changed that to to better reflect what we do here, which is focus on healthy lifestyles. I'll talk just a little bit on the next slide about what our strategic goals are for the collaborative, but essentially we try to connect and align community programs in our region. And so we do a lot of outreach and communication. So last year we sent out 110 newsletters. So that's, 2 a week. And those go to our membership, which includes over 900 partners. We also host a lot of meetings. We've hosted we've hosted over 200 now in the last 3 years, 2.5 years. We are heavily ingrained in other regional committees and initiatives, which you can kind of see some of those listed there. We really try to be an active member of the lifestyle community in Kansas City. We also try to disseminate things nationally and internationally. You can see some of the conferences we've presented at in the past couple of years. And we do all that with a very small team. I have a relatively small amount of effort devoted to this work. And then we have 3 full-time employees. Shelly Summer is our program manager, and she really is the heart and soul of the Healthy Lifestyles Collaborative. We could not do what we do without Shelly. She's been with Children's Mercy for 35 years and is well ingrained in the region and knows everything that's going on. So it's incredibly valuable to have someone like her on the team. Then we also have Katie Amy and Natalie Updike. Just quickly, I'll touch on our strategic goals for the collaborative because they're relevant to the Kansas City Physical Activity Plan. The first goal is to improve our partners' abilities to include evidence-based information and resources in their work to support healthy eating and active living for all. So that's where we get down to the hosting of meetings, sending out newsletters, trying to facilitate collaboration between all of these 950 collaborators and partners. So our partners include everything from the local health department to school wellness officers, to the bike ped organization, to churches, all the way up to physicians and council members from any of the local entities in our region. Our second strategic goal is to build the evidence base around active living and healthy eating in Kansas City. And so that's where we take on the responsibility of leading the Kansas City Physical Activity Plan. So the Kansas City Physical Activity Plan was launched in very late 2019. We typically call it 2020 just because it's easier. It is based almost entirely on the National Physical Activity Plan. And I'll explain what I mean about that in the next few slides. So the plan is a comprehensive multi-sector collaboration working to foster a culture of active living in Kansas City. And our goal is to create safe and equitable opportunities to live an active lifestyle. And it can be kind of confusing because we throw out a lot of terms that you may not use every day. So in pink, I kind of break down how I see the plan. And it's kind of like layers of the onion. On the outermost layer, you have the plan itself. The plan is comprised of societal sectors. We have 10 societal sectors that make up the plan. Each sector contains anywhere between 3 and I think 7 or 8 strategies. Each strategy includes somewhere between 3 and 6 tactics. And then at the heart of it all, at the center of it all, is actual implementation of the strategies. And this will make a little bit more sense if you're not familiar with the national plan and its structure as we move through this slide. And again, all of this information can be found on our website. So we want to create Kansas City focused sector specific strategies and tactics that will foster a culture of active living. We also want to make a collective statement that physical activity is a public health priority in Kansas City. We want to establish a multi-sector coalition to advocate for priorities, and we want to create a framework for implementation of strategies and tactics. And so by creating this coalition, it can be mobilized to do a whole host of things. Obviously, the most important one is implementation of the strategies and tactics, but it can also be mobilized to do other things as well, such as if there's a global pandemic, we have this coalition that is there that can be nimble enough and shift to really take on any type of public health initiative that we think is worthwhile. With the framework for implementation of strategies and tactics, we really want to have something that is ready to be used by anyone, whether you're a partner of our coalition or not. So we, of course, are implementing the strategies and tactics every day, but if there's some organization that is not involved in our work at all, who works out in the suburbs or in some other region, if they want to try to implement what we've developed, that's great. We have absolutely no problem with that. We also have 3 overarching priorities. One is to advocate for increased local funding for physical activity initiatives. Obviously, anyone working this space knows that it is always a challenge. Funding. Physical activity is often one of the first things that is eliminated when funds are short. So we represent a coalition of people advocating for more funding. We also are working on regular comprehensive surveillance of relevant physical activity metrics and regular reporting of those metrics through the format of a report card. And you'll see what that means in the next few slides. So here are the 10 strategies of the Kansas City Physical Activity Plan. You also have the community leads for each of the sectors. And in most of the situations, or most of the sectors, we also have implementation subgroups that are active as well. So we have schools, healthcare, parks and recreation, sport, mass media, infrastructure, faith-based settings, public health, early childhood, and business. And I'll describe a little bit more throughout the presentation. We are at strategy development for 2 of the sectors right now, public health and business. The remaining 8 are in implementation of strategies and tactics. And we're very happy to report that in the past year, we were awarded almost $350,000 for implementation. And just about half of it, just under half of it, is actually going out to community organizations. So we're not spending it, we're giving it to our partners to implement. The last thing I'll say about this slide is you can see wide diversity in sector leads that we have. Most sectors are led by 2 people, a few are led by just 1. But we've got people from the Midwest Dairy Council, healthcare institutions, multiple different parks and rec departments, banks, our city newspaper, university settings, businesses. So there's a wide range of partners that are helping us lead this work. I thought it would be helpful to just give you a quick timeline of how we have gotten to this point, because it is relevant in terms of the lessons learned. And so it really starts back about a decade ago when I was a doctoral student at the University of South Carolina. And at that time, Dr. Russ Pate was launching the National Physical Activity Plan. And I really wasn't involved in it. But of course, I knew that it was happening and I knew what it consisted of. And at that time, without knowing that I would do this work myself, I thought seems to me has the biggest potential for actually having an impact on physical activity prevalence in the United States. And so it kind of sat in the back of my head for a few years. At the same time, I was not here when this happened. This was done by other great members of the Healthy Lifestyles Collaborative, but it formed in about 2013 very organically. Started out with just a couple, kind of interested organizations who started pooling their resources, and it slowly grew over the next few years. And like I said earlier, we now have over 950 partners in the HLC. I joined the Children's Mercy and became the director of the Lifestyles Collaborative in 2016. And as I was joining and was learning about what the HLC was, I quickly started thinking, well, this existing coalition is perfectly set up for implementing a local physical activity plan. And so then I started the next several years of figuring out how we could do that. And so what a better place to start is I brought Dr. Pate to Kansas City to give a grand rounds presentation and pick his brain on how we might do this locally. In 2018, we hosted a summit, and again, I brought in someone else who knew a lot more about this than me, Dr. Cole. And we started again, just kind of thinking through what it might look like in Kansas City to create a physical activity plan. Between 2018 and 2019, I was able to secure a very small amount of money from the Kemper Foundation to launch the initial sectors of the Kansas City Physical Activity Plan. And in November 2019, we had our first meeting, and we brought in someone that many of you might know, Dr. Dan Borenstein, to help us with this kickoff event. And we started small. We didn't start with all 10 sectors. We picked the 6 sectors that you see here for a variety of reasons that I'll kind of talk about towards the end of my talk. So we started out with schools. We added early childhood. That's not a sector of the national plan, but we thought it was important. And I'll talk about the reasons why in the lessons learned part of the talk. Infrastructure, parks and recreation, faith-based settings, and healthcare settings. So each of those sectors began their sector development process, and each sector is very different. And so there's not one way that we did it, but we usually spend between 3 and 6 months developing the strategies of each of the sectors, and that's using monthly meetings. The following year in September, we hosted the first Kansas City Physical Activity Summit. We published the Kansas City report card on physical activity for children and youth, and we developed our first draft of the Kansas City Physical Activity Plan. So it was really at this point, we actually had a plan, we had supporting documents, and so this is where things, kind of really became public for us. In January 2021, we began phase 2, which meant adding 2 additional sectors, sport and mass media. In August and September of 2022, we hosted sector-specific summits, a total of 6 of those, plus an all-sector Kansas City Physical Activity Summit, very similar to the one we did 2 years earlier. And this kind of served as the kickoff of the implementation projects. And I'll talk a little bit more about all of that in the upcoming slides. And then most recently, we started phase 3, which was adding our final 2 sectors, public health and business. And phase 3 also really is the start of implementation. So I'll kind of pause and give you a sense of the overview of our plan and how we manage all of these things. So the Kansas City Healthy Lifestyles Collaborative is the backbone organization for the plan. And so my team and I really provide all of the backbone services. So we manage communications, we set up Zoom accounts, reserve rooms. Now that we're back to in-person meetings, we take notes, we draft documents. Most importantly, we get most of the funding for the plan, and that is kind of our role on the plan, is to serve as that backbone organization. The next level is our core work group, and the core work group provides strategic decision-making for the plan. It is comprised of each of the sector leads, and it also includes other kind of really important people that we just think should be involved in the administration of the plan. So there's 19 people listed here. This number actually kind of comes and goes based on people starting and leaving positions, things like that. But you get the sense of the size of the group. And then last but not least, last but not least is the 10 sectors themselves and the sector-specific work groups. So again, kind of like I mentioned, it's the layers of the onion with the sectors at the heart of it. Then there's the core work group, and then there's the backbone organization. Okay, a couple just other logistical things. As Dr. Cole mentioned, Kansas City is unique because we sit straddling two different states. If you've never been here before, if someone says Kansas City, they're probably talking about Kansas City, Missouri, but there's also a Kansas City, Kansas. For the purposes of the plan, we chose a 6-county area. And so that area includes 2 counties in Kansas and 4 on the Missouri side. This happens to correspond with the Children's Mercy coverage map, so it makes things nice and easy for things like data collection, which you'll see in just a minute. I mentioned in September 2020, we've published all of our documents, which kind of made the plan real and public facing. Here are the 3 publications that we created. There is the regional report card on the regional report card on physical activity for children and youth, the Kansas City Physical Activity Playbook, and the Kansas City Physical Activity Plan. I'll talk about the latter 2 in just a minute, but I'll first talk about the report card, just because it plays a very important role in the things that we're doing. So we based our report card format almost exactly on the US report card that is put out by the Physical Activity Alliance. So if you haven't read it, you can find it on the PAA website. The 2022 version just came out in the past few months. Here is our version, and like I said, we modeled it almost exactly after the US plan. And that means we have an overall grade for physical activity and several key indicators around physical activity. So there's overall physical activity, sedentary behavior, active transportation, organized sports participation, active play, physical fitness, family and peers, school, and community and built environment. As you can see, we range from sports participation is our best, and that is a B-. Our worst is F for active transportation, and we have several incompletes. And the reason that there might be incomplete is because of the data. And so because we obviously have 4 incomplete grades, we said, well, let's also have a comment and a grade on the quality of the data so we can try to improve how we assess these key indicators of physical activity. And so I'll talk just on the next slide, I think, on how we arrived at all of these different grades. First, here is what our report looks like. Like I said, very similar to the US plan, where we've got key findings, other considerations. We list out the data. We have a discussion of the indicators. We have a discussion of the data and recommendations moving forward. So the criteria that we use to assign a grade is in nearly every case taken directly from the National Physical Activity Plan, the Physical Activity Alliance. The indicator grade is based exactly on the primary criteria, and the data quality grade is based on these categories that you see here. And here are the data quality standards. So it has to be local data, it has to be recent data, it has to be a sufficient sample size, it has to be a representative sample of the population, and it has to be publicly available. And then depending on how many of those data quality grades, that indicates whether you got an A through F or an incomplete. For the indicator grade, we took these straight from the Physical Activity Alliance. So A through F and incomplete using these benchmarks. Here is just a quick overview of the data sources that we used for the report card and the grades that they received for data quality. And just because of time, I'm not going to go in depth on this, but I think this approach is a good approach. And I think that it is something that can easily be replicated in other regions of the country. And so if you want to learn a little bit more about it, you of course can go to our website. You can go to the Physical Activity Alliance website and find what they did. You know, like I said, hopefully it can be replicated elsewhere. Now we'll get to our other publications. And the first one is well, I'll start out with the plan itself. So the plan itself is about 80 pages because we've got lots of detailed information about who we are, what we're doing, our goals, how we develop the strategies, all of the tactics, and any supporting materials that we want to include. We realize that not everyone wants to read, you know, a big, thick 80-page report. So we created a shorter version, which is the playbook. And this is about 20 pages, and it really just has the strategies listed. So if we want to talk to a politician, for example, they may not be interested in the big document, so we'll give them the playbook version. But now let's dig into the actual plan. Our first edition, the draft was released in 2020. We released the printed copy in early 2021, and we're releasing an updated version probably in about a week. If it's actually on me right now to finish reviewing it. So as long as I can finish that in the next week, it'll be printed next week. And it's organized by strategies and tactics. So if you're not familiar with strategies and tactics, strategies are broad, evidence-informed approaches to promote physical activity. As of today, with 8 sectors in place, we have 34 strategies. For the tactics, those are more specific things and they're more action-oriented, and they support the sector-specific strategies. So each sector has, like I said, between 3 and 8 strategies, and each strategy has between 3 and 6 tactics. As of today, we have 112 tactics in the plan. So here are the 34 strategies. They're organized by sector. So each different color represents a different sector. You can find all of these on our website. It's in multiple places. In one spot, if you go to the strategy cards, these cards will appear on the screen and you can click on them and then the tactics open up. Just to get a little bit more in depth, I'll show you some sample strategies from the sports sector. So the sports sector has the most strategies. They've got 8. And the first one, which is strategy 23, is expanding access to recreational spaces and sports programming. 26 is coming up with a regional policy that emphasizes the importance of sports as a vehicle for promoting physical activity. 27 is establishing a regional entity to strengthen the stakeholders. Let's see, strategy 28 is focused around sports injury prevention. So you can see there's kind of a variety of types of strategies. Some are going to be directed towards individuals. So how can we train coaches to have safe practices that minimize sports injury? Others are more policy or organizational focused. So like strategy 27, trying to create a regional entity. And so that's a nice mix of different levels that these strategies address. Here's a closer look at some sample tactics. So for strategy 23, which is about expanding access to rec spaces and quality sports programming while focusing on eliminating disparities, it has 4 tactics. One is using, excuse me, data to identify populations who are at risk of physical inactivity. Number 2 is prioritizing community-based affordable forms of organized play, such as in-town leagues. 3 is creating opportunities for free and loosely supervised play. And 4 is incorporating sports activities into before and after school programs. So there is obviously a lot to the plan that we can't get through it all today. Between all of the strategies, all of the tactics, all of the reports that support it. So I encourage you to look at our website if you have questions. Of course, you can reach out to us and we're happy to answer any questions. But now I want to just kind of transition quickly to where we're at in terms of implementing these strategies and tactics before I finish with the lessons learned. So, as I mentioned at the start of the year, we transitioned to implementation of the strategies for most of the sectors. Again, there's 2 that are going through development right now, but all the other 8, we're working on actually implementing the plan. And it actually started back in August of 2022. And we decided to host, each sector decided to host a national level speaker who was doing work in this sector. And the idea was we would bring in these outside speakers and they could tell us about their challenges and their opportunities in their region. And hopefully it would inspire ideas for us. So each meeting was 2 hours with a 1-hour presentation and 1 hour of like Q&A or small group discussion where we talked about how we could apply what was discussed in the presentation to Kansas City. And so not every sector did it, but most sectors did. And you can kind of see we had in early childhood, there was someone talking about Go Knapsack, someone talking about integration of physical activity assessments in the electronic health record. We had National Parks and National Recreation and Parks Association. We had someone from the Play Equity Coalition in Seattle. We had Active People, Healthy Nation, media consultants for the mass media sector. And we had people from the Whole Health Child for the school sector. Then in the end of September, we had our summit, and this was a half-day summit, all virtual. We had a keynote presentation from the esteemed Dr. Cole, but most of the day, about 3 hours of the 4-hour summit was in small group discussions. We hired moderators to help us strategize specifically about implementation of the Kansas City Physical Activity Plan. And if you want to know how more about the outcomes of that summit, you can go to the website that you can see here, kcphysicalactivityplan.org /KC Physical Activity or PA Summit. We've got all of our notes and mural boards that described how we arrived at our strategies for implementation. So I'm just going to give you a quick summary of some of the implementation projects that we're working on right now for a few of the sectors. There's too many to go over in fullness. So this is going to be some very quick highlights. So for the healthcare sector, we're working on implementing strategies 19, 20, and 22. And we're doing some things like assessment of lifestyle behaviors in the electronic health record, and then connecting out to community resources. We have already established the Just Walk program. Many people know it as Walk with the Doc, where healthcare providers go out to community settings and lead a short, like 10-minute lecture, and then they go on a walk. It's a great way to share information and model behavior in healthcare providers. So we're working on expanding that right now. We've doubled the number of sites that we serve. One of the things that we're perhaps most excited about is integrating lifestyle medicine into healthcare, schools of medicine's curriculum. We have 3 schools of medicine in Kansas City. And we are bringing in Dr. Jen Trilk from the University of South Carolina, Greenville School of Medicine, and the founder of Lifestyle Medicine Education to Kansas City. And she's going to give a grand rounds presentation. And then she's going to have individual meetings that we're coordinating with each of the 3 medical schools. And we've got the curriculum developers for each of those schools in those meetings. And, you know, at this point, there's no guarantee that they will include lifestyle medicine and physical activity in the curriculum, but we think this is a key first step. It has taken probably, we've been actively working on it with the Kansas City Physical Activity Plan for about 1.5 years to have this set up. And just more broadly, I've been trying to get this for about 5 years in Kansas City. So this takes a long time, but if implemented, it's going to have a huge reach. We also are working on some reimbursement activities led by Dr. Dave White. So that's healthcare. In sport, we are starting a partnership with the Aspen Institute in August. This supports strategy 23, 24, 25, 26, and 27. This is going to be a huge project. If you're not familiar with the Aspen Institute Project Play, I encourage you to Google it. They've partnered with 15 different cities, which you can see on the screen in the map on the lower right, to come into these communities, assess the current state of youth sports, and to identify clear next steps for the groups. And because of the high credibility of the Aspen Institute, when they come to these cities, they've really kickstarted big implementation projects. And so they're going to start in August with some data collection. We'll have a summit in spring 2024, and then the actual report will be released in about 1 year or so. We are very, very excited. This is going to be a really big project for our region. For mass media, we're working with an outside media company, Overflow, to develop strategies around communicating what we're trying to do with the plan. So that's developing a plan, identifying personas, working with community partners for storytelling, developing brand assets. These are things I know nothing about. This is not my area. And so that's why it's really important that we got this outside entity helping us to do that. And here's a picture from a meeting we just had a couple weeks ago where we were kicking off this strategy development. The last thing we'll talk about is some work happening at the early childhood level. And this, again, is related to Go Knapsack. So you saw this come up in our kickoff summit kickoff meeting that we had in August, where we had someone from Go Knapsack come and tell us about the data that is available. Based directly on that, we were able to get all of the data for the Kansas City region for daycare providers that utilize Go Knapsack. And we're able to now identify areas that daycare providers in the region are doing well and areas where there are opportunities for improvement. And this data will guide the implementation projects that sector takes on. So a lot of great things happening with the plan and the implementation of the plan. But I want to spend the last probably 5 minutes just talking about the lessons that we've kind of learned along the way. And The first one is the name of the talk. And I came up with this one, or I wanted to use this as the name of the talk because Dr. Cole says this all the time, and it is absolutely critical. All health is local. Everything that we do, we try to make local. Now, what does that mean? We actually found that using the strategies and tactics that are already developed by the national plan works better than trying to come up with our own strategies and tactics in Kansas City. And that's because what the national plan has already done is identified the evidence-based strategies. They've been vetted by an expert panel, and they've been reviewed by the public. So based on that very rigorous process, there is very little that needs to be done to them. What we do is we spend literally months taking those strategies and tactics and tailoring them to Kansas City. So up to 6 months, we'll spend looking at the strategies and seeing where we need to tweak things for Kansas City. And so there are many different ways we've done it. Each sector has been a little different. All of this stuff is on our website and in the actual plan itself. But some sectors we've just used like REDCap surveys or Qualtrics surveys where we've had people rank things. In other places we've used electronic whiteboards to interact with multiple people at one time to do strategy prioritization. In other cases, in other instances, we've partnered with existing initiatives that are going on. So in 2021, right when we were doing sports sector development, the National Youth Sports Strategy hosted a Kansas City virtual workshop. So we combined our efforts and we did most of our strategy development in that workshop. The most recent strategy development that we've done is for mass media. And this is what it looked like. It involved ranking the national plan strategies based on what we thought was a priority. Then we looked at it by the difficulty level and impact it would have on health. And then we got into more specific details about each strategy, barriers, how to overcome barriers, who needs to be at the table, what do we need to do to tailor it for our region, and then a couple other things as well. So we did this for every strategy and every tactic. The second lesson is to leverage existing resources, and that involves being creative and being a good partner. So as I described with our report card, we got most of our local data from the Children's Mercy Community Health Needs Assessment. This is required by law that healthcare institutions who get federal funds have to do a community needs assessment every 3 years. We became good partners with the group at Children's Mercy who administers this, and we were able to add in questions around things we were interested in. Their survey, they take it very seriously. It's a 1,000 family survey, stratified, random stratified sample based on the demographics for our region. This is a high quality data set. And because we were able to add in our questions, we were able to get overall really good local data. So we were creative in taking what was already available in the health assessment. We started with our closest partners. We have over 950 partners, but we have stronger bonds with some rather than others. So that's where we started with our 6 sectors. The one exception to that was we're really close with local health agencies, but we didn't start with them because they were in the middle of the COVID pandemic. They didn't have the bandwidth to take on anything new. So that's why we're doing public health as the last sector. I mentioned earlier, we added the early childhood sector to the plan. That's because we had really strong ties to daycare providers in our region. And so we thought that that would be a great addition. And we're really a good partner to our community partners. We make sure that they get something out of partnering with us that will improve their work. We try to align with existing initiatives. I won't talk much more about that because of time. And we rely on our staff expertise. So again, with early childhood settings, we had a staff member who was really good, really familiar with daycare settings. So that's why we added daycare and early childhood settings. We had a staff member who was really good at design. He developed nearly all of our graphics, our reports, our websites. So we leverage that expertise. Number 3 is we focus on grass tops organization or grass tops advocacy rather than grassroots. So we focus on the organizations. And then once we get the organizations involved, we let them focus on the grassroots through their work. And then we don't really do much top-up advocacy with like local politicians at this point, but we think we will. And we rely on the national plan and the physical activity for national top-level advocacy. Couple more other things. You really have to have champions, especially initiatives. As I mentioned, Dr. Pate, Dr. Cole, and Dr. Bornstein were critical in getting us started. Likewise, were our funders. Getting a couple initial funders helped us kick it off. And as I mentioned before, we really had our key champions that we started out with for development of the plan. Number 5 is we always have to justify why physical activity should be a priority in Kansas City. We had an election yesterday. We elected a new mayor. Here is the quote from the paper this morning from our mayor. His goals for the next 4 years are to improve our neighborhoods, housing stock, build safer communities. Okay, so those are his priorities. Within my institution, the administrators think nutrition is the most important thing. Obviously, when we ask families, they tell us COVID-19 and mental health are priorities. So we have to advocate for physical activity. And so we start out with big picture things, and then we get local. And I can talk a little bit about that in the Q&A. And then the last thing that I'll end on before I open it up to questions is don't get discouraged. We have had many meetings where 2 or 3 people show up. We've had many meetings where 50 people show up. You can't get discouraged by what are perceived, what you think might be low points. You have to be very patient. This takes years of time. You have to think big, and you have to follow the plan. It is easy to get distracted by the shiny red ball, but that's what the plan is for, to keep you focused. And we do that all the time. And last but not least, ask for help. Most people that I've mentioned in this talk, they're a lot smarter than me, and they're all very, very helpful. They will answer your questions. We use the Physical Activity and Public Health textbook. Here's my rabbit-eared version. And we send everyone that we can to the Physical Activity and Public Health short course funded by the CDC and hosted at the University of South Carolina. So with that, I'll stop and open it up to questions.
Dr. Shook, thanks so much. This is just remarkable what you've been able to accomplish. And full disclosure, I knew a lot about this beforehand, and I'm a big champion as you indicated. So I wanted to make sure we got a lot of this information out. There are a couple of questions that have popped up. A couple were posted, and then I think you answered them. But the first one was, what are the funding sources? And you made it clear, particularly how that started and your recent source of funding. But for someone, let's say in a large Western area, a metropolitan area that might rival Kansas City, where would people start to get those fundings? What are your those funding sources? What are your recommendations for where to find this stuff?
Yeah, well, it really depends on kind of where you're at and what resources you have available. So we were lucky at Children's Mercy that we had some existing philanthropic partners that were interested in lifestyle. And we were able to start small and just get a little bit of money, like $5,000, that then you show that you demonstrate that you can accomplish something with a little bit, and then they can give you a little bit more, and you can go back and ask for a little bit more. So that's what we did with our philanthropic partner. We also worked with some local health agencies. So we were able to apply for some very small grants from our local HRSA office. And again, like $5,000 just to start out with. They liked what we did, and then we could come back and ask for more. So it would be great if, I talked to some people in the Pacific Northwest, they can go to Amazon or Nike and get millions of dollars. We haven't been able to do that. So we find people who have an interest in some of these lifestyle things and start small.
Well, that reemphasizes the idea of all health is local, right? What might work in the Pacific Northwest might not work in the central part of the United States. So figuring out what fits your particular thing, your particular situation, I think is important. Another question, thanks. Another question, which you touched on a little bit, but it emphasizes measurement and evaluation. What's you're in implementation now. How are you going to know if you're making a difference?
This is the area that is probably most challenging for us. And that's because, we have relatively small support, just staff support. We support all of these sectors. So within my team, we don't have a lot of bandwidth to do good measurement and evaluation. So what our solution, the big picture solution, is we're trying to create this comprehensive surveillance network, including things like the health needs assessment. We're partnering with the local bike ped organization to leverage their data. And there's a couple other entities that are doing data collection that we're trying to partner with so we can ultimately have this surveillance network. That's not going to be sensitive enough probably to look to evaluate specific things that we're doing. So for those, we try to add on additional funding to get other entities to help us. So for example, with one project, we partnered with the formative research team at Children's Mercy to do qualitative data collection for us. And so we're in discussions right now to do a more formal like CHIP assessment, like comprehensive health improvement plan assessment, as part of a city and county health improvement plan. So the answer is we are just because of our resources, we've got to partner with other people. And so it's a big challenge. We're always open to suggestions from other people on what they might be doing.
Terrific. And then finally, we got 3 minutes to go. I want to keep everyone on task. Everyone can read what's there, but from Dr. Howie, how have you found managing the multiple political climates, working with government entities in 2 states and multiple counties? It seems like a Rubik's Cube, quite truthfully, to me, and I never quite understood that. You did mention you really haven't engaged local politicians as much, but you may plan to do that. Are there key government agencies that aren't currently involved you'd like to target in the near future for this?
This is a great question. And so, I didn't spend as much time talking about it as maybe I should, but we made the conscious decision at the start of all this to focus on community organizations rather than government organizations. And we chose to do that because we had seen exactly what you talked about, shifting political climates, shifting funding environments associated with government. And we decided, let's just bypass that. Now, there certainly are weaknesses to that approach because, I always, it's a running joke, the local bike pedestrian organization, they get blamed by everyone who's mad about bike lanes going into town. Now, of course, they have zero role in installing bike lanes. That is city. But they get blamed for everything in bad times. So by us not engaging with government, we don't have a direct line to these, kind of built environment or high level policy things that are on that happen and make a really big difference in physical activity prevalence. So that's where we're kind of shifting in implementation. We're trying to get this groundswell of community organizations. And at some point, we will reach a tipping point where the government entities are going to say, listen, we need to engage with these partners as well. And so that's kind of our current approach. Again, there's pros and cons to that approach for sure.
Well, that makes sense. And it actually probably buffers you against some of those changes that happen with local elections and so forth. Dr. Shook, I'd like to thank you immensely for your time today. We're right at time. And so I want to keep everyone, but it's just a phenomenal job out there. And for anyone who wants to learn more about maybe how to do this in your own community, please reach out. You can find Dr. Shook on the interweb and learn a lot more about what the pearls that he and his team have put together. A shout out to Ayanna McKnight from the Physical Activity Alliance, as well as Makia Keith from the American College of Sports Medicine and the Physical Activity Alliance for support today in organizing all this. I'm sure things went wrong, but no one on this side of the table saw anything that went wrong. Anyway, thank you all very much for joining us, and we'll look forward to the next one.